What is the correct order of draw when using the evacuated tube system? A. Red, green, lavender, gray. B. Yellow, light blue, red, green. C. Light blue, yellow, green, gray. D. Green, lavender, red, yellow. Answer, B. The correct order of draw prevents cross-contamination of additives. Yellow, blood cultures, light blue, coagulation, red, serum, green, heparin, lavender, EDTA, gray, fluoride. Which of the following is used for blood cultures? A. EDTA tube. B. Sodium citrate tube. C. Sterile yellow SPS tube. D. Heparin tube. Answer, C. The sterile yellow tube contains SPS, sodium polyenethyl sulfonate, used for microbiology and blood cultures. What additive is found in the light blue top tube? A. EDTA. B. Heparin. C. Sodium citrate. D. Fluoride. Answer, C. Light blue top tubes contain sodium citrate, used to test coagulation by binding calcium. Which vein is most commonly used for venipuncture? A. Brachial. B. Cephalic. C. Basilic. D. Median cubital. Answer, D. The median cubital vein is the preferred site because it is large, superficial, and has fewer nerves around it. What is the maximum recommended depth for a heel puncture on an infant? A. 1 mm. B. 1.5 mm. C. 2.0 mm. D. 2.4 mm. Answer, C. Heel puncture depth must not exceed 2.0 mm to prevent bone damage in infants. When labeling a specimen, which detail is essential? A. Phlebotomist's name only. B. Patient's initials only. C. Collection time and patient's full name. D. Tube color and lab department. Answer, C. Accurate labeling includes the patient's full name, date of birth, and time of collection to ensure traceability. Which tube should be collected first in a multiple draw when using a butterfly needle and coagulation testing is required? A. Light blue. B. Red. C. Lavender. D. Discard tube, then light blue. Answer, D. A discard tube is necessary before the light blue tube to remove air from the tubing and prevent dilution of anticoagulant. What does hemoconcentration result from? A. Drawing blood too quickly. B. Prolonged tourniquet application. C. Using a small needle. D. Vigorous mixing of tubes. Answer, B. Prolonged tourniquet time causes blood components to concentrate due to plasma filtering into tissues. Which color tube is commonly used for glucose testing? A. Lavender. B. Gray. C. Green. D. Red. Answer, B. Gray top tubes contain sodium fluoride, which preserves glucose levels by inhibiting glycolysis. What is the correct angle for needle insertion during venipuncture? A. 15 to 30 degrees. B. 45 to 60 degrees. C. 5 to 10 degrees. D. 60 to 75 degrees. Answer, A. An angle of 15 to 30 degrees allows proper access to the vein while minimizing the risk of going through it. What should a phlebotomist do if a patient refuses a blood draw? A. Proceed anyway. B. Call security. C. Document refusal and notify nurse/doctor. D. Leave without telling anyone. Answer, C. Patients have the right to refuse care. The phlebotomist must document and inform healthcare staff. What type of sample is required for ESR, erythrocyte sedimentation rate? A. Plasma. B. Serum. C. Whole blood. D. Buffy coat. Answer, C. ESR is performed on whole blood, typically collected in an EDTA, lavender top, tube. What is the primary cause of clotting in an EDTA tube? A. Insufficient mixing. B. Incorrect needle gauge. C. Drawing order. D. Tourniquet use. Answer A. EDTA tubes must be inverted 8 to 10 times immediately to prevent clot formation. What additive is in the green top tube? A. EDTA. B. Sodium citrate. C. Lithium heparin. D. Fluoride. Answer C. Green tubes contain heparin, an anticoagulant used for plasma chemistry tests. A capillary puncture is typically done on which finger of an adult? A. Index. B. Middle or ring finger. C. Thumb. D. Pinky. Answer B. The middle and ring fingers are preferred due to better circulation and lower risk of nerve injury. Which of the following may cause a hematoma during blood collection? A. Vein selection. B. Inserting needle too shallow. C. Failure to remove tourniquet. D. Failure to apply pressure after draw. Answer D. Not applying pressure can cause blood to leak into surrounding tissue, creating a hematoma. What is the purpose of an antiglycolytic agent? A. Prevent clotting. B. Increase cell count. C. Preserve glucose. D. Maintain pH. Answer C. Antiglycolytic agents like sodium fluoride prevent the breakdown of glucose. Which site is inappropriate for capillary collection in newborns? A. Heel. B. Big toe. C. Lateral plantar surface of heel. D. Medial heel. Answer B. The big toe is not used due to the risk of nerve and bone injury. What is the appropriate action when a vein is missed during venipuncture? A. Redirect without withdrawing. B. Dig to find the vein. C. Withdraw, try a new site. D. Continue aspirating. Answer C. Always withdraw and try another site to avoid tissue damage. EDTA tubes are typically used for which test? A. Glucose. B. Point/INR. C. CBC. D. Electrolytes. Answer C. EDTA preserves cell morphology, making it ideal for complete blood counts, CBC. Which of the following could lead to a false positive blood culture? A. Incorrect order of draw. B. Skin contamination. C. Slow transport. D. Low sample volume. Answer B. Poor antiseptic technique can introduce skin flora, contaminating the blood culture. When should the tourniquet be released? A. After bandaging. B. After needle is withdrawn. C. Before needle is inserted. D. As blood flow starts. Answer D. The tourniquet should be released as soon as blood starts flowing to avoid hemoconcentration. Which test is most affected by hemolysis? A. Hematocrit. B. Potassium. C. WBC. D. Point/INR. Answer B. Hemolysis releases intracellular potassium, falsely elevating results. What PP is mandatory during venipuncture? A. Mask only. B. Sterile gown. C. Gloves. D. Hairnet. Answer C. Gloves protect both the patient and the phlebotomist from blood-borne pathogens. What type of hazard is a needle stick injury? A. Chemical. B. Physical. C. Biological. D. Ergonomic. Answer C. Needle stick injuries expose phlebotomists to biological hazards like HIV or hepatitis.